she's gonna be here.
Well, hello. Hi, Dr. Sarah here, and I have Dr. Kimberly Klausner. We are going to wait for some people to join, so when they join, we'll see names appear there, just like that.
Okay.
Oh, there you go. Oh, we got Gina Bax. Hi, Gina. Gina's going to tune in because she's got 5 girls.
Hi, Gina.
Hi, Gina. And we're just going to be waiting for a few more people to join, and we will get started any minute. So I just wave to people like that,
Okay.
and then, we've got a fan.
That's Valerie.
Okay,
Or
hey
Valerie's
Valerie.
husband.
How you guys doing? And we got my husband. I think he's gonna, there's Lisa. And we got Monica. Well, welcome everybody. We're gonna wait for a few more people to join. Actually, we're waiting for, there he is. Okay, let's split the screen. So he requests to join. I allow him to come in or kick him out, either one. I don't know if I should clue this. Hey!
Hey,
How you doing?
good. How are you?
Good.
Hi, Susie.
Hi, Susie. We got a bunch of people on right now. Okay. Well, we got a very special guest, Dr.
Super special.
Yovino. We've got Kimberly Klausner here, Dr. Kimberly Klausner. She is pediatrician to all of Beverly Hills, and our 2 kids. We'll just give a little bit of a background to some people who don't know her, but we do have some fans I already see on here that we know. But Kimberly went to Beverly Hills High School, and then she went to Northwestern for undergrad. She ended up back here in LA at UCLA for medical school, and you did your pediatrics residency at Children's Hospital in LA. See, I did my research.
Okay.
She's a fellow of the American Academy of Pediatrics, past president of the LA Pediatric Society, and is currently serves on the board of directors. So if anyone's going to be knowledgeable about kids,
I hope.
it's going to be this one, okay? So get your
what
questions
superstar.
ready. What's
Super-
that?
Kimberly there, superstar. I love hearing all that,
So we can't hear you that well.
What? Oh.
Can you turn up your volume or something? I think the folks.
God, always telling me what to do.
That's my job.
Is that better?
Yep.
Okay.
She's also mother to 2 lovely kids. Well, and a third big kid. But she's got Jessica, who's 16, Andrew, who goes by AJ, who is now 14, right? And then her big kid, David, her husband. And now they have a beautiful, cute as anything dog. If you haven't seen her Instagram, it's all over her Instagram.
Yep.
Loki. I was going to say Kaya, but okay, Loki. Super
all
cute.
over her Facebook.
Or her Facebook, that's right. So we wanted Kimberly here, Dr. Klausner, and to ask her about all things related to vaccines. So many people ask us questions. They ask us questions about themselves. They ask us questions about their children. And now we know that the COVID vaccine has been open to kids 16 and over. And we would love for her to kind of touch upon that, talk to us about that, and sort of answer everybody's, what are you doing, Justin?
All right. I just saw this as an option.
And answer, we can't even hear you.
Really? I don't know. Is it better when I do that? I wonder if it has to do with the way my camera was sitting. Is it still bad or no? Volume's
It's
bad?
a little bit better with whatever you just did.
Okay.
Okay, so let's first talk about COVID in general and how has it changed your practice?
Okay. So it's been more than a year now that we've had the quarantine with
Hi, Jessica.
COVID. Hi, Jessica.
Hey, Jesse.
And it really had a huge impact on practicing in general. At first, no one wanted to go to the doctor at all. So our office was very slow, and we put in a bunch of different protocols for keeping the healthy kids in if they wanted to come in for regular well visits and checkups and vaccinations, which are super important, and for helping out people who were sick without having them come into the office and expose other people. Because at the beginning, we thought everything could possibly be COVID. So telemedicine really took off, and in our office, we probably do about at the beginning, we were doing about 50% telemedicine and 50% in-person visits. And telemedicine was video calls like this. We would have a system where patients would dial in, we would dial in, we would have a video conference with them. We could do a very good history. We could do a little bit of a physical exam. I got very good at telling parents, okay, feel under here to feel where kids' glands are. And we really kind of made do with telemedicine instead of having people come in. No one wanted to leave their house. Nobody wanted to come up in an elevator in a big building. Nobody wanted to come and risk being exposed. So
I remember, and you did the drive-by flu shots. I did that. I joined.
Yeah.
My kids and I got in the car and did a drive-by flu shot. That was great.
Yeah. In the fall, instead of having people come into the office for flu shots, we had a drive-by on the weekend in the parking lot where we did everybody's registration in advance. And
it's in the underground parking lot.
Yep.
It was like a whole assembly line.
Yep.
You pull your car up. They had all the authorizations. You sign. Someone sticks. You roll down the window. They stick your arm, and then they go to the next person. It was great.
Yeah. It worked
literally
out,
like
right?
5 minutes, flu shot, done.
Yeah. And unlike with the COVID vaccines, they make you wait for 15 minutes. With the flu shots, we didn't make the kids wait because there wasn't any risk of anaphylaxis and because they weren't driving. So
yeah, it was great. What about so let's talk about vaccines in general.
Okay.
So what's your viewpoint? Yes, I mean there's non-vaxxers and then there's vaxxers. Are schools requiring kids these days to be vaccinated? Okay.
Yeah.
So what happens if you absolutely refuse to vaccinate your kid?
So in California, there are very limited medical exemptions for children to not be vaccinated. So
has that changed recently?
Yes. So when they start school in kindergarten, they're required to have a certain specific set of vaccinations completed. It used to be that you could just opt out of it. It used to be that you could claim a religious or personal belief that you didn't want your kids vaccinated. And now California became very restrictive in the past couple of years, and you have to have very specific medical reasons not to vaccinate your kids.
And is that only public school or public and private?
Public and private. So basically, if you really don't want to vaccinate your kids and you don't have a legitimate medical reason for it, you kind of
have to homeschool. Right.
Yeah.
Oh.
So it's because it's a
Who
public
wants
health.
to do that?
It's a public health issue. Besides just being an individual health issue, it's a public health issue.
Well, there was a bunch of kids that that died in Oregon, didn't they? Because they had mumps and there was a big mump outbreak, like with pre-COVID.
So there have been a couple of big measles outbreaks.
Oh, measles, that was probably it.
In the States in the past 20 years. And it spreads more easily in unvaccinated groups of people. So there was a big one in Texas where some people who were of a religious group that did not believe in vaccinations, someone went on a medical mission to Africa and they came back and brought measles back with them because it has a very long incubation period. And they actually spread it among their congregation because they had a large group of not vaccinated people hanging out together. So vaccines are one of the biggest successes of medicine in the 20th century.
Well, you have a T-shirt that Justin loves.
Yeah, I was about that on my way home today. Yeah, right?
Yeah.
So vaccines make adults, right? Is
Yeah,
that what
vaccines cause adults. I wear it, and people always ask me, what does that mean? And I'm like, well, we vaccinate children and so they can grow up and live a long, healthy life and then die in their 80s or hundreds of cancer. But at the beginning of the 20th century, the top 3 causes of death were all infections: influenza, pneumonia, measles. And by the end of the 20th century, we vaccinated all those out of business.
And I remember when I was younger, polio was still kind of an issue and phasing out a little bit, but there were definitely people who had polio.
Yeah, we all have grandparents who had polio,
right.
or grandma's friend or auntie.
We had a president that had polio.
Yeah, but we know somebody who had polio who's left with long-term neurologic problems because of it.
That's why there's a lot of people now, because of the COVID vaccine that's been available to the public, who say, I don't want to vaccinate. And I say, well, okay, you have to understand you've lived, I don't need it. And I said, but you've gotten to this far because you've been vaccinated already and you've lived a very comfortable, healthy life because you've been vaccinated. So you don't know what it's like not to be protected and all of a sudden, have all these ailments.
Yeah.
So so let's talk about the COVID vaccine and talk about what's available for kids 16 and above.
Okay. So the only COVID vaccine that's approved for kids above 16 is the Pfizer, which is the mRNA vaccine. It's also, they've been testing it on kids down to 12, and they just submitted to the FDA this month for an approval for kids down to 12 years old.
Oh.
They've shown that it's safe and it is effective. It hasn't been approved yet for kids that young. I expect that it will be by the summer. And really, it's more important that we vaccinate adults because they're at a higher risk for severe disease and death from COVID than our teenagers or young adults.
So what do you say to somebody saying, okay, Dr. Klausner said I didn't have to vaccinate my kid?
No.
She said, only adults.
Well, you have to recognize that these kids may expose other people if they get sick. It's kind of the same reason why we give.
So you're not saying they won't get COVID?
No, you're saying that they won't get COVID, or less likely to get COVID and die from COVID, or get COVID and have long-lasting complications from COVID, or have severe disease, or end up in the hospital.
But they can take their COVID and give to grandma,
exactly.
or take their COVID and give it to mom and dad and kill them.
Exactly. That's why we kept kids out of school, because we pretty quickly realized that kids weren't at risk for dying, but they're
the biggest spreaders
of any sort of viral illness. So that's why we kept kids out of school for a long time.
Germ bags.
So came down.
Those
germ bags.
Yeah.
Germ
They're
bags.
little balls of snot. Yeah. So anyway, so the COVID vaccine's approved for kids down to 16. In California and the rest of the United States, anyone 16 and above can go out and get a COVID vaccine. It is 2 doses. It is 3 weeks apart. They just approved it.
Did you have Pfizer?
Yeah.
Yeah, I did too.
Yeah, because it came out early. That's what we all got, because it came early. But my 16-year-old has had her first dose of vaccine. I feel very comfortable.
My son has had both doses.
Oh, good. Yeah, because he's in Utah.
Yeah.
So they have better vaccine rates than we do here.
Mm-hmm.
So, where was I going with this?
You were saying that the vaccine 16 and over.
16 and over, safe, effective, and I think that kids actually even have slightly lower side effects than adults.
Now, have you heard that the COVID vaccine specifically can interfere with fertility issues or fertility?
Okay, so that's a rumor that's been all over the internet, and there isn't really any legitimate science behind it.
Okay.
So I don't need to poo-poo people's beliefs, but if you look into how these things work, it's like saying that, oh, I made the vaccine with a chicken egg, so this can turn you into a chicken. There really is nothing about the vaccine. There is really nothing about this vaccine that can affect women's fertility. And in fact, when they were doing the original studies on the Pfizer vaccine, they did not enroll any pregnant women, and they told women not to get pregnant. However, they had over 100 people in the original study that got pregnant by accident during the study. So that means that those people were not trying or trying, but it doesn't show that there is any decrease in fertility. There's actually an increase in fertility among those people who were told not to get pregnant. So.
Hey, Sarah.
Well, maybe they thought they were safer, so then they became riskier.
So we can kind of, let's bounce all over. One patient asked that the question that keeps coming up about fillers and the vaccine, and is there any issues with that?
Yeah, there actually are some reports of increased risk of side effects with people who have had fillers. Swelling, soreness, joint aches. And I don't really know how the mechanism of that works. And I was going to ask you guys.
So some fillers, some dermal fillers out there already have a propensity to have inflammatory responses at times. Like if you had your teeth worked on, or you got a little sick, they can swell. That area can swell and become inflamed and almost look like a nodule, like this big old So certain fillers that are on the market pre-COVID had a propensity to do that. So my guess is that, without naming names, that it's probably that line of fillers that has caused that in other people. That's what my guess is, because nobody else that I know, and I don't necessarily use that filler, and so none of my patients and nobody that I know has had an inflammatory response from getting vaccinated.
Yeah, and it's hard to know the cause and effect, right? Because fillers, we know sometimes they have their own complication. It's very small, but yeah, they can get swollen. You can get a reaction to it, and it may not even be associated with the vaccine at all. Can you hear me? What's up?
Yeah, you're kind of grainy, and like, can you hold on one second. I need to let.
Do I need to get some makeup on?
Yeah.
The hell?
I have a very nice makeup artist. She lives at my house.
Yeah. Oh,
yeah,
sweet.
She can do you too. So.
Wait, where's Sarah going? What's she doing?
She had to let someone in.
Oh, okay.
AJ just came, so I had to let him in.
Oh, got it. Okay. Yeah, so I don't know the cause and effect, right, with the fillers, if it's the vaccine. I mean, any sort of, everybody's getting the vaccine, and so everybody's got everything of all different things, and it's hard to say if it was just a complication of a filler, right, or if it's associated with that or not. You can't say that right now. I don't, so I'm not sure if I buy it.
Justin, you're super, I don't know, are you seeing yourself as being pretty grainy or no? Because can you just move closer to the Wi-Fi source or something? Because it's really.
I'm not grainy on my end, but
no, it's okay.
Yeah.
Okay. So do we answer?
I saw someone ask how effective the vaccine in kids 16 and above. So the original Pfizer trials were done with 16 and older. So they were part of the 94% effective. There are ongoing studies at some big hospitals, including Cedars-Sinai and Mount Sinai in New York, where they're looking at the thousands of people that they gave vaccine to, and they're studying them afterwards to see what the rates of disease are, what the rates of side effects are, what the rates of all these other things are. And so we're coming out with more and more information all the time. Cedars-Sinai was actually one of the places that came out with the study that just showed that people who had COVID recently actually had a much greater immune response to the first dose of vaccine. And so people who had COVID recently eventually might only need one dose.
Oh.
So, okay.
Well, and you go to Cedars and see brand new babies and things like that. Have you taken care of any newborns of a mom who had COVID or anything like that? And do they have 3 heads? I mean, what are you saying here?
I have not had any newborn babies where the mom had COVID at the time of the delivery. And I just talked to one of my friends.
Or what about during pregnancy?
I have had a couple of people who had COVID during their pregnancy. And anecdotally,
does the baby come out without spikes on it?
No, the babies are fine and dandy and look totally normal. Apparently, the moms were a little sicker than they had expected to be. If they had COVID during their pregnancy, but they all recovered, and I don't know any that ended up hospitalized. I don't know any women that ended up with miscarriages due to COVID. And then
that would have been a good question for us to ask Lauren too.
Yeah. But I will say that we saw this whole year, we've seen lots of kids who had COVID, and we haven't seen any that have been seriously ill.
And what do you mean lots of kids? Like, give me an age group. Because I'm hearing from some people, kids can't get COVID. I don't need to worry, and I don't need to vaccinate my kid.
No, we had...
That's Kathy. If you're watching, Kathy, it's you. I'm calling you out.
So our youngest patient in the practice that had COVID was 5 weeks old. They got it from a parent.
5 weeks.
5 weeks. And they ended up in the hospital overnight because infants under 2 months old with any fever at all end up hospitalized overnight, just as a precaution. And they went home in a couple days and they did fine. I've had plenty of toddlers and young school-age kids who've had COVID, teenagers who've had COVID. Almost all of the younger than teenage kids got it from a parent.
I was just going to ask you, how did they get it?
Or a caregiver at home.
Oh,
they did not get it from school. They did not get it from friends. They got it from a parent or a caregiver at home.
And then what about the teenagers?
The teenagers got it from each other. I don't know what they were doing. They're out and about and hanging out and, you know, not being as careful as we would like them to be. But I did have quite a few teenagers who got it and no one else in the family had it.
They're farting and burping on each other. That's what
They're
Right.
you know, hanging out and macking. I don't know.
And then what about like how bad was their COVID? I mean, you hear about like hospitals, Eric.
We didn't have any patients that were hospitalized. We didn't have any patients that we sent to the emergency room. We didn't have any kids who ended up on oxygen. We're very lucky. I'm part of a big group of pediatricians, the LA Pediatrics Society, and among all of the private practice doctors that I talked to on the west side and the valley, none of us had any patients who died from COVID. 222, knock on wood. According to, I talked to a PICU doctor, pediatric intensive care unit doctor at Children's Hospital. He said that all of the kids at Children's Hospital that were in the ICU were either morbidly obese as their underlying, you know, predisposing factor, morbidly obese or congenital heart problems.
No.
So it was not asthma that was a risk factor for kids being sicker. It was not my kid gets sick and has bronchitis all the time. It was kids with congenital heart defects or kids who were really
I would think like cystic fibrosis, maybe I've heard of that group too.
He didn't say that.
No.
So yeah.
Morbidly obese. Did you hear that? Take away that Twinkie.
I just ate a whole sleeve of donuts. Damn it.
Just get your kids outside, get them activities, get them out and about and moving. That's much more important than holding off on the Twinkie. So get them
We
a
need
little
to
sunshine.
we got to turn off the internet.
So get them off the internet.
Right.
You gotta shut it down. We should have internet pauses of this whole, you know, like sections, like areas, like, you know, LA shuts the internet down for a day or so. I don't know. And everybody goes outside, you know. You know, I feel like we should take the cues from the Orthodox Jews that, you know, are walking around here for 24 hours, you know, and removing all electronics and all this stuff. And I see them out there with their families and you know, I'm like, that's great. You know, it's really wonderful. Anyway.
People who do that really like it. They say it's like family time and it disconnects them from
so I mean, obviously, right?
Yeah.
It's we all look at it with envy going, oh, that's so sweet. That's wonderful. And if you don't, then something's wrong with you, you know?
Well, you know, I try to put my phone down and then I'll go to it hours later and I get a text and then I read the trail of text from the same person. I get increasingly more angry as time goes by and I haven't answered the text.
And then you block them. Hey, so listen, Gina is asking multiple questions and, you know, so I know that family. I know them. They're not vaccine friendly, at least this vaccine. I'm not sure about all the other vaccines. I'm assuming they're okay with all the other ones.
Stacey's been vaccinated with everything.
Yeah, I think they're okay with all the other vaccines, but this one they just don't like because, you know, I think it's all the political side of it. But she's asked some questions like, what's the COVID survival rate for kids 16 and older? I know it's kind of a loaded question because I know she probably doesn't want them to get it because the survival she thinks is very low. Very high, and, you know, death rate's very low if they get it. So, I mean, the kids, right? 16 and older survival rate.
Again, the risk of, you know, long-term complications, severe disease, and death in kids is really low. But it depends on what these kids' exposures to other people are. Okay, do we want to have to shut down nursing homes and not have anyone ever go visit grandma again like we did for the whole year? No, we like our freedom. We like to be out and about. We like to be outside and not wearing masks. And we like to be able to see people and touch them. We're both vaccinated. This is why we're close. So if we get a large enough group of the population vaccinated, then we won't have to do this again. Okay?
Yeah, they just announced that outside for fully vaccinated people, you can forgo the mask. Let's see how quickly they allow the public to jump on that. But that was the CDC's newest recommendation. But it's outdoor only.
I understand people's individual worries about giving their child a vaccine. But if everyone felt that way, then we'd be stuck inside again, you know.
What do you think about people that think the vaccine has a little microchip in it? And they did this intentionally so they can, you know, track everybody.
They're tracking you all day long with this every single day. I'm not worried about an extra chip. I'm already being followed and traced. So
Yeah, you know, it's funny. Gina says it's a controversial subject. It's not controversial. Everybody's making everything controversial. It's just science, and it's what we've been doing with all the other diseases. It's just because of the environment, and everybody's got a voice, and there's a lot of people that don't know anything, you know. So,
well, I mean,
sorry,
and also
Gina.
I think you need to look. Well, first of all, they're in a very small town, which doesn't mean that small town people can't get COVID, but it's not as rampant as it was here in Los Angeles. And her husband's very against it. And so I think you kind of follow the lead of who's in the, what's that look for?
Oh no, I'm sorry. I'm
She's
just listening.
throwing friends on the bus here.
No, but it's true. It's true.
No,
You're
I'm
speaking the
trying to
truth.
say
He's not for it. I mean, he's not like ranting about it, but I know what he thinks in his head.
Right. And so
I told him he's
people
going to
are
end up like
afraid.
Ted Nugent, who was all against it, and now sick as a dog from COVID. So,
Yeah.
Right. Well, you know, you end up, you know, eating your own words if you're
Yeah, I would like to see this go away. I would like to see this fade into the sunset, like polio and like diphtheria. You don't know anybody who's ever had diphtheria, but everyone you know has been vaccinated against it.
Well, let's talk about another vaccine besides COVID is HPV. So that's also another one that, you know, for you know, teenagers, it's important. And you were telling me there's a cutoff. If they do it before this age, it's this. If they do it after that age, it's that. And what is HPV and why would they want to vaccinate from it?
HPV vaccine is one of the best new vaccines that we've come out with ever because it prevents a cancer.
So it's one of two preventable vaccines that prevents cancer. One is your hepatitis B vaccine, and this is your second one. It's your second chance of protecting yourself against cancers, and that's oral. It's oral cancers, penile cancers, cervical cancer, that, you know, vulvar and vaginal cancers, and rectal cancer.
there you go, saying penis again. I love that.
So the HPV vaccine has been around for 15 years now. When they first came out with it,
human papillomavirus.
I'm sorry.
Yeah.
You want me to do the spiel? Okay. HPV stands for human papillomavirus. It is a virus that causes warts, but not those cute little warts that you get on your finger.
They're not cute either.
Or the bottom of your foot. These are warts that you get in your private parts. Girls get them inside usually, and boys get them right on their penis.
I want to tell you something really gross. So I, doing anesthesia, was taking care of a girl, and they had to take her into surgery because hers, she was immunocompromised or something. Hers had grown so much, they looked like dreadlocks between her legs.
Aww.
It was really, really gross.
Oh, poor girl.
God, I don't know if I ever heard that story, if I just erased it from my mind.
I think you erased it. It was gross. It was really gross. Anyway.
So HPV vaccine was originally given only to girls, teenage girls and women when they first started giving it, because they thought it was only connected to cervical cancer. But later on, they found that about 30% of mouth and throat cancers in young adult men and older men were caused by HPV.
Michael Douglas
Famously went on an interview and said, I did not get my throat cancer from smoking. I got it from, I'm not saying.
Yeah.
Sex addict.
Yeah. From a woman. And it can be passed from men to women, women to men to men, women to women, in all the various different ways that you can put those parts together. So it was super prevalent back in the 80s and 90s before we had the vaccine. When they tested college women, about 75% of college women had HPV on their cervix. So most people will get rid of it and it will not turn to cancer, but in a fairly
16, 18 or so, 14, 16, 18 strains.
Yeah, the strains. But most people will get rid of their HPV. So 75% had HPV at some point during their college years. But there's something like 30,000 women who died from cervical cancer in a year before we had the vaccine. So it was a pretty decent burden of disease. Anyway, we started vaccinating girls. Then we found, well, why don't we vaccinate the boys that are giving it to the girls? And then we said, wait, we found that if we vaccinate kids when they're younger, they have a better immune response. So if we give it to them before they turn 15, they only need 2 doses of the vaccine to get the same protection as people over 15 need to
It was a
get
three.
from
It was
three.
a three
It was
part.
a 3-part.
Same as like hepatitis with one, and then a month later, and then 6 months later.
Yep. Mm-hmm.
And then, what about? Well, is there a cutoff? I know you only take care of kids till 18, but is there a cutoff for people? What if someone's like, well, you know what? I want to protect myself, and I haven't gotten it yet, so I'm 35. I want to get it.
Yes, the original study was done up to like 27 years old, but I think last year or 2 years ago they did some more research and it opened it up to 49.
Wow.
Yep. So women can get it if they feel like they have increased risk. If you have a friend who, just is sowing her wild oats later, then you can recommend that they get the HPV.
But why did they cut it off at 49?
I don't think they had anyone over 50 who volunteered for the study. So
has there been any controversy with that vaccine? Any pushback or any?
Originally, there were people who didn't want to give it to their kids when they were in their early teens because they said, why should I vaccinate my kid against something that's not a risk for them now? And back in the day, my argument for them was, no kid is going to tell you 6 months before they decide to have sex.
Right. Yeah.
You don't have that leeway. And now I find it's much more easy for me to convince people to do it earlier when I tell them it's 2 shots instead of 3. The kids all want to go for it when I say that. So. Mm-hmm.
Yeah. So are you getting any pushback from the parents at all? I mean, I'm sure everybody gets offered it. You recommend it when they're the right age, and any of them saying no, or they pretty much say,
there are
yes?
some people from very religious communities around here who feel like their children are never going to have any sort of sexual contact except the one person that they marry who they think is also going to never have any other sexual contact. And
so they think the risk is not.
Yeah,
they think the exposure is not there, but
Yeah. So I think there's no downside to the vaccine. It's relatively low risk of side effects. And I mean, it works really well. And in I think Australia, they have a very low rate of cervical cancer significantly after they've introduced the vaccine.
Oh,
yeah.
What about the combo vaccine with if we need boosters for the COVID and just the flu shot? They're going to combine it? Do you know?
Well, we don't know if we're going to have a booster for the COVID shot because the very first people who got the COVID shot got it last August. It hasn't even been a year. So we don't know what happens with people's immunity.
The first vaccinated people started in August?
Yeah, the studies. Yeah, those were the people in the
studies. Oh, because you started. That's when you
No, we didn't get it till December.
Till December.
The people from the studies. They started giving it in August. So I don't think that we'll have an answer to that question until this winter. And then could they combine it with a flu shot? Probably not, because they, again, have to do safety and efficacy studies when they combine 2 vaccines together. This is the thing in pediatrics, because we keep trying to put, all the different shots in the same needle to save kids from a poke.
Yeah.
And they have to do all of the studies showing that it's just as safe and just as effective. So I don't think we have a hope of people getting 1 needle with a COVID and a flu vaccine this year. But if it does come to pass that we need COVID boosters, yes, that's something they could consider. So.
I just wondered, like the controversy stuff, I don't see there was ever a controversy against the flu vaccine like there was with this.
There's a lot of people who don't get flu vaccines. They don't say it's controversial. They just say, "Oh, we don't. I don't need it. I don't need it."
Well, yeah. They're just. That's a different reason,
Right. So,
but still, same thing.
There should be any
actually,
controversy with the COVID vaccine. This is not a political statement. This is not having to do with where you live or who you vote for. This has to do with protecting yourself and protecting the people around you and the people that you care about from this terrible virus that decimated the world. It's, we have a good control over it here in Los Angeles, but look at what's going on in India right now.
Well, I think we have a good control over it because everyone just had it. Like not that long ago. So of course our numbers are going to go down because India was quiet for a while. Now it's like blowing up, you know? Mm-hmm. So that was my theory on that. But
why are they blowing up right now?
There's several countries that have had a second.
Were they just in hiding and then boom, they just came all back out?
There's new strains.
Yeah. Can kids with seizures get the vaccine? Yes. That's not a contraindication at all. So, in fact, I don't think seizures is even a significant side effect. Excuse me.
Are there any vaccines where kids with seizures can't get? Like, can they not get the flu shot? No, I haven't heard of that. I haven't heard that for anything.
Someone says, why isn't it FDA approved yet beyond emergency usage?
What is?
Why is it not FDA approved beyond emergency use?
What is what?
The vaccine.
Well,
The vaccine.
because it is
The vaccine. I don't. No, it's not. I think that's a public health question that has to do with how the FDA approves things. I mean,
and
the
COVID
tests are still just EUA. So I think that has to do with more with, the politics of getting something approved.
And bypassing certain channels,
right.
And doing it in a rapid way.
Yeah.
Yeah. But they did go through, a full set of testing. They did, they did animal testing, and then they did human testing, and they did
human testing on 20,000 people. That's
more than that.
I thought it was 20.
Oh, I think that's just one of the vaccines. I think
that's Pfizer.
Okay, right.
Because then the one from Russia, they didn't even get to phase 3. They did phase 2. No, they did phase 2.
Okay, phase 1 is safety,
right.
And phase 2 is
efficacy.
Well, efficacy, and phase 3 is safety and efficacy together in larger groups.
I thought it was lab.
Wrong.
Human.
Wrong. No, just kidding.
No.
Are you sure?
Yeah.
She knows. Come on,
She doesn't know. She doesn't know anything.
She knows. God.
Warp Speed, Lisa, was that they were already putting money into producing the vaccines even before.
Well, Warp Speed was Trump's what he coined.
Effective. Yeah, I know. They gave lots of money. So the government poured lots of money into producing the vaccines. So, because that's what they had to do much more quickly than usual.
Hey, so let's talk about the birth rate around this time. Like, so Dr. Klausner sees newborns in the hospital, and I was asking her, is it is it changed? Is it up? Is it down? What's happening?
Yeah, because we thought that with people all having to be indoors and together and not have to work as much or whatever, that we would see this huge population boom.
Yeah, no. It did not happen that way. We expected that, towards the end of the year that we would start seeing a lot more babies and a little mini baby boom, and it has not happened. There's been a bit of a baby bust.
Which means less babies
are born than the year before at this time. And I was saying that I think the only people who were trying to have more children were people who did not have any children yet and didn't know what it was like to be stuck at home with your child. So people who already had 1 kid or 2 kids, they were like, oh no, I don't want to add to this.
It's the start of the new Handmaid's Tale season.
Yeah.
And the birth rate is down.
That's tonight, the first,
Oh.
The birth rate is down, right? So it's all Hollywood's fault.
Yeah.
Yeah.
So.
Oh, what about the divorce rate?
That's up.
That's what he said.
Yeah.
I'm sure.
No, I think they said it was,
So
that's
not my
the
department.
papers are on the table now.
They say a lot apparently nowadays.
They.
I actually was just asked today if I could refer someone to a divorce lawyer. So.
Oh, really?
Totally. Yeah. So.
And what'd you say?
I actually know of one.
Oh.
So
great! I'll take the number.
Click.
Just kidding.
So,
what else? And then you wanted to go over some other things. Puberty. Oh yeah. Now, I don't know if it makes. We've talked about it before, but kids and puberty, and it's coming down and down and down in age. And what do you make of that?
Okay, so it has not come down and down and down as much as people like to think that it has. The average age of a girl's first period has only gone down by a few months. Between 1900 and 2000, it only went down by a few months.
So what is it right now?
So it's like 12 years,
no way.
6 months. Yeah, it is. One of the biggest drivers of that is overweight and obesity. So,
Sorry.
what's behind you, Doctor?
Sorry.
He's messing
Are
with
you
it
just
again.
playing with things? Yeah. So it hasn't gone down in an enormous way, and in an enormous way. And I think that I get this question a lot.
Like, is it the food? Is it hormones?
It's lack of activity and overweight is the biggest driver of that for girls, because we're not seeing earlier puberty for boys. So.
Huh. Yeah. It's not YouTube.
No, it's not YouTube.
Actually, YouTube's having
not the milk.
Yeah.
It's not the milk.
Yeah, YouTube's having the opposite effect. They're not even interested in girls for a lot longer. Seems like YouTube's too much more exciting than girls.
Oh, my husband's on. Hi, husband.
Hey.
Hi, David.
He's taking a break from golfing to watch me.
So you're oh man, why are you doing that, David? That's good. So the periods haven't changed. They're not really significant. You said
but only a few months. It hasn't been a lot. And I usually find that, when I have girls, the biggest predictor for that is their moms or their paternal aunts. So when girls come in and they say, "Oh, when do you think my daughter's going to get her period?" I say, "Well, when did you get yours? When did dad's sister get hers?" And it's usually pretty close to that. I haven't had an increase in kids with precocious puberty. Precocious puberty is when they have puberty really significantly earlier. And I've been practicing for 20-something years. So, I don't think that it's moving significantly right now. And I can say over like 100 years, only moved by like 3 months. So.
Do you think kids are getting smarter earlier?
Kids are getting smarter.
Have you noticed intellect change over your practice in regards to the timeline of when?
Or because of electronics?
Yes. It's because they have much more access to knowledge than we did. Our kids have all of the knowledge in the universe available on a little square box that they carry in their pocket.
Yeah, I said, how did you learn that?
Right.
Minecraft.
Right.
Like, huh?
And they learn, they have the opportunity to learn a ton. So the kids who are smart and who are interested have much more opportunity and much more knowledge available to them than we did. Remember you had to go write a paper and you had to go to the library.
Yeah.
And you had to look in a book. And you had to go, when you were in medical school, you had to go to the library and you had to find like the journal that only your library had. But your library didn't have that
weird like scanned in thing that you had to
microfiche.
Yeah,
microfilm and microfiche. So now our kids have access to everything. So I think that kids that are smart and interested can learn a lot more.
We, so Kimberly happens to be the pediatrician to our children. And I took Tyler to see her and you were probing Tyler about his diet. And you said, well, so what do you eat? And he's like, well, and you said, what do you eat that's healthy? Yeah. And he's like, remember he said, well, is chicken and rice healthy? And you said, yes. And you're like, and then, well, what do you eat with that? Or what do you eat with, and you're trying to get him to say vegetables, I think. Right. And he's like, condiments? And you're like, what?
No, yeah, what do you eat with the meat? And he's like, condiments.
Yeah. Like, someone has a question.
That's not the only thing she was probing.
Yeah, right. He didn't even want.
No, so Gina says, do redheads have more propensity to have irregular periods? I would say that question is, do you see anything different in redheaded children? Is there any?
I actually do have something in it, but I guess it's okay because these are all moms here. We're not talking about there's no children watching except for mine. Jessica, don't listen. I do find that redheaded people have much more sensitive skin, and I find that redheaded moms have a much harder time with pain with breastfeeding. Isn't that a weird one? I totally find that. Yeah. I don't know if redheaded women have more irregular periods. I would guess not.
Is that because the hair's red? There's a lot of red going on?
I think the redheaded thing that I see is just because people with red hair tend to have much fairer skin, more likely to burn, more likely to get freckles. And I find that people with that kind of skin tone tend to have much more sensitive nipples when they're breastfeeding. So
yeah, they're Fitzpatrick 1. They're more prone to.
Wait, Sarah, you're not redhead though, are you?
What?
You sensitive nipples,
I was talking about with breastfeeding. I'm a pediatrician, so you can talk about boob lifts another time.
I'm gonna click. Anyway, so back to she says
about skin. You want to talk about
my
skin?
redhead skin issues already, and she's only 12. Oh yeah, we had a code. It was I didn't even put it on here. It was. Can you put it on, Justin? It's Dr. K20, Dr. K20, and that is for 20% off our acne regimen. So she's got a lot of teenage patients. They all are breaking out. Like,
wait, is it? Are you doing it the DRK?
No, Dr. DOCTOR K for Dr. Kimberly.
I go for Dr. K.
Yeah, Dr. Klausner. Dr. K20, which will give a total of 20% off the products within the regimen. The regimen's already discounted 15%, so this will make the total regimen discounted to 20%. So it's like an extra 5 something off of it, the total retail price of each of the individual products. But it contains our anti-acne serum or acne defense serum, our acne pads, which have 3 different kinds of acids in it and help sloughs off, clogged pores and dead skin. And then I think it comes with our cleanser and toner, which are monster sizes, but they're really good. And you can put them in the bathroom or the shower. And here's like our serum and then the pad. So 20% off the regimen, which is online at YovinoMD Skincare. Do you pin it?
You got to pin it. It's on your end.
I do. Where is it?
I feel like we should put it in a lunchbox.
Where is it? I just see special discount. Oh.
Yeah. And I feel like we should put it in a lunchbox, for teenage. Well, even though lunchbox is no such thing, right, anymore. I'm dating myself.
No, there's not lunchboxes.
Yeah.
Yeah, they're not.
They just don't have the Beatles on
and
it
they don't have
or the Rolling Stones
on the front of them anymore, but they do carry lunchboxes.
Yeah.
Okay, so teenage skin. So yes, your teenage kids should be washing their face twice a day with a gentle cleanser. Yes, they should be using some sort of
papaya in it.
Some sort of salicylic acid product in a toner or a wipe that they put on twice a day. And then retinoids, there's a lot of retinoids in over-the-counter products too. Be careful because some kids are sensitive to it. If it makes their skin red or flaky or dry, then they should start with doing it every other day. And then work their way up to once a day.
Well, night, because it
deactivates in sunlight after bedtime.
And then also ours contains niacinamide in it, which is like a soother. So for kids that have very sensitive skin, our lowest dose retinol is amazing for that because it's encapsulated in time releases and does not irritate most people's skin. I'd say, I don't think anyone has ever complained that their skin is too irritated with that.
Okay.
It's at nighttime only. And depending on how old you are, you want to do it per decade of life. So nighttime. So if you're in your teens, really 1 night a week is probably good enough for you. If you are in your 20s, you want to work your way up to 2 nights a week. If you're in your 30s, 3 nights a week, 40s, 4 nights a week, and so on. So we're using it the whole week. Almost, yeah. And so we have that whole regimen. So you can get the teen regimen or you can get the teen regimen with just the retinol in it as well, but they're all great. Great.
Hey, Kimberly, back to just a vaccine question. Do you know any info on the patient's response to the vaccine, and is that any indicator of their level of immunity? So if somebody doesn't feel sick at all, gets the vaccine,
No. So you don't have to have a side effect to develop immunity. We know that. I always tell my patients now, I love the COVID vaccine because 75% of people have a side effect. So it makes my shots that I give to babies and to toddlers seem so easy, like baby vaccines. Because, kids' vaccines are anywhere between 5 and 20% of kids have a side effect. I feel like a lot of adults were like looking for a side effect. They feel like if they didn't have a side effect, it didn't work, but that's not true. we know that they develop immunity even if they did not have side effects.
Well, what about people that say, oh, you shouldn't take any kind of anti-inflammatory Tylenol right before the vaccine or right after the vaccine because you're going to mess up your result. You want your body to have, some sort of response.
Yes. So the recommendation not to take Tylenol in advance came from a pediatric study that looked at the antibody production immediately after vaccination, and they found that kids that had a dose of Tylenol given before they had a vaccine actually had a lower antibody production, but that kids who had vaccine after they received kids who had Tylenol after they received the vaccine had the same immune response. So it's fine and safe to take Tylenol or ibuprofen after you have the vaccination, but you should not take it before. And remember that this was based on a different vaccine and it was based on children. So it might not be true for grown-ups, but pretty much we think that just stay away from taking it before and it's okay to take after.
I had another question about the vaccine. So it was the pre-treated Tylenol and I can't think of what it was. Pain. Was something probably to do with, I can't think of what it is. Did you have a question, Justin, while I try to think of what it is? I was thinking.
My life is full of questions. So. I don't know. No, I don't have anything other than that, really. I was just thinking about one of my patients who told me she got the vaccine, didn't have any response to the 2 dosages. But then we started exploring her postoperative experience, and she was kind of interesting. She didn't drain it all from her liposuction, right? And she was concerned with that in a recovery because most patients drain a lot, right? And she's like, I'm not draining it all. Is this a problem? I said, well, that's not a problem, but it turns out that she peed like crazy. So she absorbed all of it and just peed it out. And she said, then, you know what? Come to think of it, when I got my vaccine, I peed a lot, actually, with the vaccine. It made me pee a ton. So it was just like her response to and she had no reactions. She didn't feel sick at all from the vaccine. And so that's why I kind of brought it up. Does it mean anything? But she just heals very quickly. And I don't know, her system works differently. So just, physiology and how we all function is differently.
Yeah. We know with flu vaccine that whether you have a side effect or not has nothing to do with how effective it is. So I think that this is just because many people are anxious about the COVID vaccine and they're trying to find something to say, oh, I felt sick, so it must be working, or oh, I didn't feel sick, so maybe it's not working.
And what do you tell people that do kids get a second COVID shot? Yes, the Pfizer's are 2 shots.
Yeah, the Pfizer, they finished the studies on 12 to 16-year-olds, and they've asked for approval. So we expect that 12 to 16-year-olds will be able to get the Pfizer COVID vaccine this summer. And it will be 2 doses.
What do you tell people that, okay, so say their kid had COVID already. Now they're coming to you for the vaccine. What's your cutoff? They had to have had it how long prior? Has it happened yet?
No, but when the vaccine was first released, the CDC said that you should wait 90 days after having had COVID before you get the vaccine. And that was because we had a shortage of vaccine. That was not because there was anything dangerous or bad about getting the vaccine after you had COVID. We think that your immunity lasts for at least 90 days, and so that's where that number came from. And there was a shortage. But now that there's no shortage of vaccine and it's available for anybody who wants it, we're not telling people to wait 90 days after you had COVID before you get the vaccine.
Because I heard someone saying, oh, you got this huge inflammatory response and it's 10 times worse.
No, you're slightly more at risk to get side effects. But again, side effects are 75% in adults. So everybody's going to have a side effect anyway.
Jessica's saying that Kate says hi. Kate? Yeah, Kate. Hi, Kate. Was she with Kate?
Yeah, I guess so.
Well, another thing you guys probably don't know about Dr. Klausner is she can cook a mad sour bread. Bake, I should say. Sourdough.
Yeah. So.
She, look at that.
We all had to learn our COVID,
what?
We all had to learn some new skills during COVID, and I learned how to bake bread. Woo-woo. So
that was good. I baked some, but she would bake this great sourdough, and it's an art form.
It's fun and it's very relaxing.
But don't you feel like you have to
do something with it all the time,
and then you take a little piece of it and then make bread and then keep that going, fermenting or something.
Yes. So I have something living in my refrigerator at all times. Really fun.
Is that David's? Yeah. You mean David?
Yeah, David's living in the refrigerator. Ooh, David, you hear that?
Oh, who was the person who got disconnected and missed the answer?
I think she was asking about the 16-year-old. Let's see. She was the one asking about do kids get a second COVID shot?
Yes.
Kids get a second COVID shot. Only the Pfizer is approved for kids, and that's 2 shots given 3 weeks apart.
And then you said something else about under 12 to 16 is
12
being
to
approved.
16 is
not approved yet.
Not approved yet, but we expect it by the summer.
By this summer, do you give the vaccine in your office?
We are applying to give the vaccine in our office. As of right now, in Los Angeles County, I don't think any private practitioners are giving it in their offices, but we are all applying to be able to do that because I think, with 16-year-olds, they're fine to go to the drugstore and parents don't mind. But I think when we get down to 12 and even younger than that, I think people are going to want to come to their own doctor and they'll feel more comfortable with that. So we are getting ready to be able to give the vaccine as soon as we get approved to do it.
And you are available, and if anyone is living in the area, are you taking new patients?
Yes, always taking new patients.
She is taking new patients, so anybody who
kids, teens, I love them all. We take care of kids from.
I was thinking you were saying
birth
teens
until
having
college.
Newborns.
No,
what?
No. From birth until college. I do have a few grand patients.
Birth until college. And college, what's grand patients?
Grand patients. I have patients that were my patients when they were teenagers and they're now moms.
Oh, no way.
Yeah. So I have a few.
Are you, so also vaccines are going to become mandatory, are mandatory for a lot of colleges.
Yes. So birth until college. So generally colleges at this point require kids to have a meningitis vaccine if they're going to live in a dorm. But quite a few universities and colleges have said that they are going to require kids to have COVID vaccines if they are going to be living on campus or going to classes in person. So there's a whole lot of universities that are saying that for this fall. So for people who are wary of vaccines, if you have college-aged kids, this might not be your choice.
Right. And then what about also camps, like overnight camps, things like that?
Well, because it's only it's not.
Oh yeah, 16.
It's 16.
Yeah.
Then I've had some camps who have said all of our staff is going to be vaccinated, and that's like a nice advertising point for them. It's a good advertisement. I can say my whole office is vaccinated, so when patients come in, they shouldn't be able to get COVID vaccine from my staff.
Yeah.
And some of the sleepaway camps are saying that, which is a nice thing.
Mm-hmm. I scored 2 U.S. Open tickets today, but one of the requirements is that you have to be vaccinated.
Oh,
wow!
Yeah. So if you're not, you got to show. Obviously, I guess you could make up a fake card. If you want to go to it. But anyway, they're requiring it to enter.
Awesome.
I got invited to a brunch of the women doctors, and they asked you to take a picture of your vaccine card before you came, because they wanted everyone to be vaccinated.
Interesting.
So, yeah.
Reasonable.
Yeah. All right. Well, Dr. Klausner is accepting new patients. Anybody looking for a new pediatrician and is in the area, check her out. Roxbury Pediatrics. She's in Century City, which is right next to Beverly Hills. You moved from Beverly Hills into Century City in this beautiful office that overlooks Beverly Hills High School. You guys.
I was just thinking that. I love how it looks over the track and stuff.
Yeah, but no one's really gonna. Your patients don't sit in your office though, do they? Do they sit in your office?
No, they don't now anymore.
Okay. Well,
unfortunately,
but her office is beautiful and it overlooks the track and everything of Beverly Hills High.
Yeah. But if they don't, I post on Roxbury Pediatrics Facebook and Instagram all the time. Lots of stuff, information, funny things, pictures of my puppy, which is surprisingly the most popular.
So if you look at my post for this live, you will see her Instagram handle, which is roxbury.pediatrics. At roxbury.pediatrics, and you can get a lot of tips from her and other things like that. You can see how cute her dog is. So check her out and follow her, please. And we would like to thank you for joining us.
Yeah,
thank you guys all for watching. Hope this was informative. Bye.
All right, bye.
Bye.